Good morning, everyone. Thanks for joining us today. So today we have the workshop Tips, Advice, and How-Tos presented by SFSU's Breakthrough to Nursing Board. They're going to go ahead and take lead. And yeah, we can go ahead and get started. Thank you all.
Okay, so hi everyone, welcome. We're just going to quickly ask that everyone put themselves on mute just so we can hear each speaker clearly. And we just want to inform you guys that we will have a Q&A portion at the end of this presentation. So if at any time you guys have any questions, feel free to shoot them in the chat and we will be answering all of them to the best of our ability at the end. And probably due to time constraints, we might not be able to get to all the questions. So feel free to email us at our email, which will also be provided at the end of the presentation. But we just want to thank you guys all for joining us. We know that right now everyone's prepping for finals and you guys are all super busy studying, but we do hope that you guys can benefit from this presentation and hopefully you guys find it very helpful. We do want to say a quick thank you to Amy and everyone from the CHSS Resource Center for collaborating with us and helping us coordinate this whole workshop. So a huge thank you to them and a quick thank you to our guest speakers. We have a couple panelists who will be joining us as well. So we just want to send a quick thank you. But for now, we'll go through a quick introduction. So this is our Breakthrough to Nursing Committee. My name's Christina, and I'm a BSN level 3. And basically what the levels mean, they kind of correlate with each semester throughout the nursing program. So for the bachelor's program, it's a 2-year program, so 4 semesters total. So I am in my 3rd semester out of 4. And a little bit about my background in terms of prior to like applying to nursing school. So I went to SF State right out of high school. I did 2 years of taking prereqs. My first year I was exclusively at SF State, and then for my second year, my first semester of that second year, I was dual enrolled at SF State as well as City College. And then for that second semester, I went to City College exclusively. Yeah.
And I'm Lily or Liliana. I'm a level 3 ELM, which is the master's program. And basically level 3 is 3rd semester out of 6 for the master's program. So it's a 3-year-long program. And my emphasis is in peds right now. And for the ELM program, you have to get your first bachelor's degree. And I got my first bachelor's in psychology at Santa Clara University.
Hi everyone, I'm Charmaine. I am BSN level 2. And my prior pathway to nursing school was that I was a pre-nursing student at SFSU initially. And then I took 1 semester leave of absence for City College and then came back to SF State and applied.
Hi everyone, my name is Tina. I'm an ELM level 3. I'm in the same exact cohort as Lily. I graduated from UC Davis in 2012. I took a few years off to work in the workforce and joined nursing school about a year and a half ago.
All right, so before we begin, we first wanted to let you all know that this presentation is based on the nursing students' perspective and knowledge. Everything was gathered from our own personal research and from other current nursing students' advice. So don't be discouraged by all the information that's been given today. It's all collective just to give you some tips and ideas on how to, or how the different paths students took to get into the program. Everyone's journey is different, so we encourage everyone to do their own research as well. And then lastly, most of the information given out today is based on the SFSU nursing program, but you can also apply it to other schools as well. So on the next slide is a breakdown of what we'll be discussing today. We'll first start with how you need to prepare prior to applications. We'll talk about the experiences current nursing students had to make themselves stand out, as well as volunteer opportunities during COVID that you guys can look at. We'll then talk about the application process, and then we'll wrap up with advice and Q&A. So when you decide on pursuing nursing, our first tip would be to make a roadmap of all the things you want to accomplish in the next few years and all the classes you want to take. SFSU has a really great roadmap you can follow on their website. That's personally what I did. And you also want to start thinking about all the schools you want to apply to and plan on applying to multiple programs. As you can see on the image on the side here, there's many different pathways to get into nursing, so you don't have to take the traditional route. There's the associates, the ADN to BSN. I know that City College and San Mateo College has an ADN program, and then they have a contract with SFSU so that if you take and apply to their associates, you can take a bridge to get the BSN at SFSU. You can also get a bachelor's in something else and then either get a second bachelor's in nursing or a master's in nursing. So there are a lot of pathways you can take, so do your research on what's available. You can even try other state schools in the Bay Area. There's really great ones, even across the state. And then there's also accelerated programs at SFSU. We have the BSN-A and the MSN-A. Those are faster programs, but you don't get the winter and summer breaks like you do with the regular programs. And then you also want to make sure that you research what's required for all these different programs. So if they require the T's, the HESI, the GRE, if they require like supplemental information, volunteer hours, our first tip would be to make a spreadsheet. That's what a lot of the students did in our cohort, was to make a spreadsheet of all their classes and all the schools that they plan on applying to, so they have it all in one page, because there's a lot of different deadlines that you want to keep track of. And then you also want to have multiple backup plans just in case the first one doesn't follow through. I know at SFSU you need 96 units or less in order to apply to the bachelor's program as an undergraduate. So that's something to keep in mind. So we also want to talk about impacted classes, because we know it's really hard to get classes at SFSU. So our first tip would be to crash. And if you don't know what that means, it's basically attending the first day of school in a already filled class, something you couldn't get during registration, to see whether the teacher would be willing to give you a permission code, because usually they tend to try to fit in as much students as they can. And if you can't do that, especially with COVID, it's not, I don't think there'll be in-person classes anytime soon. So trying to email those teachers and to explain your situation. There's probably a lot of students doing that as well, but it doesn't hurt to try. Another way or a tip to get into impacted classes is to try to look for priority registration. It's really hard to get priority registration if you're not in a program or you're not in sports or anything like that. So usually what teachers do would send a mass email to students in the beginning of school to see whether a student would take notes for another student who otherwise couldn't take it for themselves. And then that way you can get priority registration for the following semester. And then our last tip would be to, if you absolutely can't get classes at SFSU, try community college. They're cheaper, convenient, and it's easier to get into the prereqs there. Personally, I took off one semester to take to go to City College and take my full units there, because I couldn't get all my prereqs at state. And so I did that too, because I found out that you can take a leave of absence, so one semester off without penalty, as long as you enroll into classes the following semester. So you will still be a student there.
Okay, so now we're going to kind of talk about our experience and different nursing experiences. Most of this info is going to be from a survey that we sent out to the current nursing students. All of the levels answered. We got a bunch of responses, and basically we just asked them kind of how they got into nursing school, what their direct patient care experience, what their indirect patient care experience was, any advice they had for you guys. So that was really helpful to look at, and then we'll show you kind of what they said. This first one is just kind of about the direct patient care experience that a lot of students got. And now I think it's called health related work on the applications for SFSU specifically. As you can see, a lot of it was CNA, which is a certified nursing assistant. But there's also a lot of other options. There's a medical assistant. We have both of those people. They're going to talk to us today about it. You could be a phlebotomy, you get your EMT license, and then some people even had none. So you don't have to have the direct patient care experience in order to get into the school, as long as you have some experience working with people, working with any kind of patient population, it's going to be okay. So these are just some options that you can look into, but they're not the only ones. And then these are some of the specific certifications that people got, which is just like an extra step. I wanted to put and show you guys how 50% of the people had none. So you don't have to have a certification to get in. So don't worry if you feel behind, you don't have your EMT license, you don't have your CNA, you're okay. Like 50% of the people who are currently in San Francisco State's nursing program do not have it. So it's fine. But again, CNA was really popular. EMT is pretty popular. One thing you do need for nursing school in all nursing schools and a lot of like volunteer experience in general is your CPR and your BLS. So definitely I would recommend getting those as soon as you can. You can even do it during COVID. You do a lot of stuff online and then you can go in person for like 1 day or 2 days or something like that. But yeah, you need that for nursing school at least, and a lot of volunteer opportunities. So if you knock that out pretty quick, then you'll be able to more easily get into different places. In the next slide. This is the indirect patient care. It's now called underserved community. Biggest one here was volunteering at a hospital. That's what I personally did, and I'll talk more about that in a minute. But another one, none, again, some people didn't have any, but there's things like babysitting, which looks really good if your kids, the teachers really like that you at least have some child experience, and babysitting is great for that. I was personally a water polo coach, so if you're any sort of child experience, they're going to really like. Telemedicine was big, and that's going to be huge for you guys who are doing COVID kind of stuff, because that's kind of what's out there right now. So doing any telemedicine is going to look really good on an application. But yeah, just taking a look at that. And then next slide, please.
So these are some of the volunteer opportunities that our team kind of looked up in research that is available during COVID. We will drop a link into the chat with all the direct links to the volunteer forms or whatever. And we highly suggest that you look through that, because we are in the middle of a pandemic and things are constantly changing, and the needs of the population out there is constantly changing. But just to bring up a couple here, for example, Meals on Wheels. Specifically, I'm pretty sure a lot of people have heard of it, deliver hot meals to elder or vulnerable populations in the city, which is very important, especially during COVID, for our geriatric population where they cannot leave their house. And that would look great on your resume if you engage in that. And it is quite safe. I did 2 months of it, and it is contactless deliveries. I will say that kind of think about what your interests are. You don't necessarily have to know what you're interested in before going into nursing school. You may have to if you are applying to the master's program, because they're going to ask what emphasis you would like to choose when you're applying. So for example, the SF General Hospital doula program works specifically with women's health, and it's a program that trains you from beginning to end. So you don't have to have any type of requirement or experience. All you need is just wanting to work with women and wanting to work with that population. Another one that came up that I actually never heard of quite frequently in our when we were compiling information was Wise Health. As you may know, a lot of school has an emphasis in closing the gap to health disparities, and especially San Francisco State nursing program has a huge emphasis on social justice and providing for the less fortunate and the vulnerable populations. So Wise Health specifically attacks that, and their mission statement is to eliminate the health disparities, improving access to care among racial and ethnic minorities, which is a great thing to engage in if you're trying to get into a program like San Francisco State, who does emphasize a lot about that. And I looked at their website, and they have a lot of community fairs. They do like companionship visits, things like that, and none of that requires any experience. So we highly recommend looking at all the links and see what fits with you and your schedule, and be proactive in volunteering, especially during COVID. It is very needed right now, and a lot of places are actually accepting. So I'll go ahead and drop that link in the chat for you guys to look at.
So this one is just discussing kind of hours that people got. I believe that San Francisco State, you need 120 hours to be counted, but obviously people got a lot more than that. It's just good to know like how much patient care, indirect or direct patient care experience that you're looking for. Obviously, the more you can get, the better. But it's whatever works for you. And then, yeah, some people even had less than 100, so don't feel discouraged, but definitely you want to get over that 120 so that you can be competitive, and then anything over that is going to look amazing.
Okay, so now we're going to have some of our committee members as well as our guest speakers speak a little bit about some of the volunteer or work experiences that they had prior to nursing school. So we're going to start off with Lily.
Yeah, so specifically for what I did volunteer-wise to kind of make myself a more competitive applicant was I volunteered at a hospital in Santa Cruz, basically actually Monterey. I volunteered and all I had to do was look at their website. I knew the hospital and I knew I liked the hospital. So I just looked at their website and saw if they were accepting volunteers. Always accepting volunteers. It's really fun. I worked in the ED. And I was able to kind of see, all I was doing was taking patients back and forth to ER rooms, taking visitors back and forth to ER rooms, wheeling people's in wheelchairs. No really direct healthcare experience. But what I did get to experience was kind of watching the triage nurses take vitals, see how it works to really work with in the ED and like what is most important. And that was actually really helpful for me to learn like what vitals even were. Like I didn't even know what vitals were. So like, you know, just getting any patient care experience or just watching nurses and even in taking a backseat and just watching is super helpful. So if you can get any kind of experience like that, I would definitely recommend it. And it was free. I didn't have to do much of anything. I think there was a small interview, but all I did was look it up online. So it was easy to do.
Okay, so I'll just speak a little bit about my experience. So I knew already from like in high school that I wanted to go into nursing. So I started off volunteering in high school, and I did the same thing as Lily, just look up any hospitals in the city that were not hiring, but accepting volunteers. So I started off at CPMC in their California campus here in SF, and I was in their postpartum unit. I worked very closely with some of the nurses. We did a lot of setting up rooms, making ice packs, and a lot of cleaning and filing, patient charting stuff. And we answered a lot of phone calls, call lights, and you know, kind of worked with the patients in the sense of providing them like water or anything that they needed, as well as helping discharge the patients. So we would just walk them down to their car and get everything set up for them. And then also throughout college, I volunteered at UCSF Mission Bay in their playroom, as well as in musical therapy. You basically just interacted a lot with some of the patients, but mostly the patient's siblings. And that was just a really great experience in the sense that we kind of, you know, provided them an environment that was different than all the medical treatments that they've been experiencing or that the family members have seen them go through. So we kind of help them relax in a sense and find the hospital to be an enjoyable experience. So yeah.
So I'm going to speak to my experience as a medical assistant. I was a medical assistant for about 3 years. I worked first in a private office for a urologist, and then I started to work at UCSF as a medical assistant. And I think what is different about my experience is that I'm actually not certified as a medical assistant, which kind of speaks to, you don't really need a certification to seek out these opportunities. I will say that in order to get a position as a medical assistant, especially at UCSF, that only requires CPR, you do need some sort of health experience. For example, hospital volunteer work or being a medical scribe. For me, I was an EMT for a while, and then I didn't really like that, and I wanted more direct patient care, so I started scribing in an ER, and that was what kind of led me into becoming a medical assistant. I spoke to that experience, got my BLS, and they accepted me. And what I did at UCSF, I worked at a otolaryngology office. I was a float. I worked in multiple subspecialties, including facial plastics, pediatrics ENT, adult ENT, and voice and swallowing. I felt like it was a great experience to be a float. I would definitely take that opportunity if you could, because I was exposed to many different populations, and I was able to work with peds and adults, and figured out that I was more an adults and the elderly population person, and that's why I emphasized in adult gerontology. And my job, lots of different things, rooming patients, taking vitals. It really depends on the clinic, and the great thing about that UCSF is that, again, you don't need a certification to be a medical assistant. You just need a CPR and some experience. And it also helped me learn kind of the workflow of the hospital. It helped me learn, the electronic medical recording programs, which is very important to know once you are a nurse, because documentation is going to be a huge part of your job. And I got very comfortable with taking vitals. I got comfortable with learning abnormal values, and also learning communication between other nurses and other doctors, and getting comfortable and confident with that. So if any of you have any questions, please feel free to email us at our email, and about medical assisting specifically, and I would love to answer any of your questions if you have any. But next, I will introduce our next guest speaker, Marin, who has experience as a medical scribe, which was kind of like what I did to lead me into medical assisting. So Marin, please take it away.
Thank you. Hi guys, my name is Marin. I'm a ELM level 3, so I'm in Tina and Lily's cohort as well. So Lily mentioned certifications earlier. When I graduated with my undergrad, I changed my mind with what I wanted to do about 2 weeks before graduation. So I ended up going and getting my phlebotomy certification. I couldn't find a job anywhere, and I was like, oh my God, what am I going to do? So I started working as a scribe. I got hired by one of the scribe companies, and I worked in outpatient John Muir. I was in the pediatrics as well as family med, and then I did do rheumatology as well. I ended up working my way up. I was there for like 2.5, 3 years, and I ended up working my way up to becoming the manager of all of our 30 sites. While it had its challenges, I learned so much working as a scribe. Especially in outpatient, when you're dealing with patients on a day-to-day basis, you get to learn a lot of the medications and a lot of these diseases that they come in for. So that was really helpful, especially in the first semester of nursing school, when we're talking about hypertension and diabetes and hyperlipidemia. I'd been dealing with all of these patients who had, especially in family med, all these diseases previously. And so the meds I was always really familiar with already. It also really helped because in my pediatric experience, I worked with a lot of patients who'd come in and getting their vaccines. So I knew the vaccine schedule and I knew what vaccines would be given and when. So I really enjoyed it because I think it did give me a little bit of a leg up, especially the first year of nursing school, just knowing what things are, what you would do. I may not have known everything, but I definitely felt a little bit more confident going into classes when it came to certain diseases and medications. If you can work as a medical scribe, I think it's a great opportunity to expose yourself. It also gives you kind of a sense of different areas. So like rheumatology was super interesting. I don't think I'd do it, but it was really interesting. It also is actually what helped. I always knew that I wanted to work with kids, but it also helped solidify my specialty, which is in peds like Lily. I had babysitting experience, but working with adults in family medicine is really what helped push me into like, yeah, no, I want to be in, I want to be in peds, not family med. Like I just want to work with kids. So I think just getting that exposure to medications, to what is done in visits. And then again, like I would do all the documentation for doctors. So I know Epic inside and out now. And it's great because the hospital that our peds rotations at uses Epic. So I pretty much already know how to use it and find things within the chart. And while it may not be the same that I used while I was a scribe, like it's pretty transferable, which also just makes it so much easier. And I think knowing more is never a bad thing. So I would highly recommend it. Great intro into the medical field. It will give you a little bit of taste of what you might see, what field you might be interested in, and you definitely will pick up a lot of information that you can use in nursing school. Yeah.
Okay, and next we have Trina, who worked as a caregiver, and she also got her CNA licensing. So Trina, go ahead and take it away.
Hi, so yeah, I'm Trina. I'm also a level 3 ELM with Tina, Lily, and Marin. And in high school, they offered a program for CNA training. So the first 2 periods of my class, I actually went to a, a skilled nursing facility and like got all the training and went through the testing to get my CNA. But I never worked as a CNA. So during my undergrad, I actually worked as a caregiver, which involved much of the same tasks that you would do as a CNA. And I got a lot of experience from that. You learn how to take vitals, you help with activities of daily living, whether it's toileting or bathing, and you just learn how to build that rapport with patients, which is really important as a nurse, to build that relationship and get information out of them to later help them. And what else? So if you are looking to gain experience and you don't necessarily want to get your CNA, I would highly recommend looking for caregiver jobs because you get much of the same experience and you can start working pretty much right away. As a ELM student, you have to have a letter of recommendation from like a healthcare type, like a manager. So that would also be beneficial. So you can build a relationship with your manager and then have them write you a letter when you're ready to apply, which is very important. But yeah, I'd highly recommend being a caregiver.
Okay, and last we have Hanson, who has his CNA cert and worked as a CNA. So if Hanson, you can speak a little bit about your experience.
Thanks, Tina. Hi guys. So I got my CNA certification at a community college. I know most community colleges that offer a nursing program, like Contra Costa, which is where I got mine's, and Merritt College in Oakland. And American Red Cross also offers a CNA program as well. So I went through the testing and I actually got hired at the place where I did my clinical training. So I was at a skilled nursing facility and I got hired halfway through my my class in the CNA. So I don't think there's ever going to be a shortage of CNAs. So if you ever feel like you need like an easy transition from going from pre-nursing into nursing, I think CNA is a really good chance to do that, because for me, my background is I did my undergrad as a bio major, and out of that I did some lab work for a couple years, and I just wasn't really fulfilling, so I transitioned into looking into nursing, and I thought CNA was the closest relation to seeing how the workflow and getting all that patient interactions, which I really enjoyed, and which kind of helped motivated me to become a CNA. And then that really helped like solidify like my want to become a nurse. So I think being a CNA is pretty helpful. One thing I do have to say about being a CNA is that it's, especially at a skilled nursing facility, it's a very humbling job. So don't think you'll be doing like giving injections, passing meds, because those are more to the nursing duties. So what you'll usually be doing is like checking up on the patients or residents. You'll be feeding them, giving them baths. But you are basically the nurse's eyes, because they have 3 times the amount of patients you do, and you'll be looking out for them. I think this really helped in my first semester of nursing school here, because the first semester you do long-term care, and that's really just, you'll be at a SNF, which is a skilled nursing facility. So I think it's a really good transition. And even if you don't have a CNA, I know I think the first semester of most nursing schools, once you finish that, you can apply for a CNA as well. So it's never too late to get one. I think really it's kind of like doing the grunt work of the nurse. So I know during my time talking with other nurses, that they said whoever was a CNA before they became a nurse, they usually have the best patient relationships, because they're able to, build that rapport with patients, deal with bedside manners. I know that's a really big thing. Requirements to receive your CNA certification, I think you only really need your BLS, which is the CPR certification. That's it. And I know for most schools, they have a requirement of health direct patient hours. I did like over 200. So I think 120 here at San Francisco. Other schools require over 200. But yeah, I highly recommend being.
Okay, so thank you to all the panelists that shared their experience. You can see that everyone had a different journey, but they're all here in the nursing program. So now we're going to discuss the application process. So for transfer students, there are 2 applications that you need to fill out, the Cal State Apply and the Nursing CAS. This would apply to you if you're applying to other state programs. So for example, if you're an SFSU student wanting to transfer to like CSU East Bay, you would have to apply on Cal State Apply. So Cal State Apply is basically applying to that school and enrolling to that school. And then you would have to apply on Nursing CAS, which is enrolling into that school's nursing program. So if you're a current SF State student and you want to apply to the SFSU program, all you have to do is apply on the Nursing CAS since you're already enrolled into the school. And then Nursing CAS makes it really simple. They're both actually similar applications. You put in the same information. And then for the next slide, our first tip would be to check important dates and then write them down, because every semester there's different dates changing, when applications open, when they close. And then You also want to request for transcripts early. I feel like that one takes a really long time because it needs to be sent and approved. We also want you to request for verification letters early as well, maybe at least a month or even more. So verification letters, basically having your volunteer manager sign this off for you with a signature. There's a template on SFSU that they want you to use. You can put in how many hours you did and then what you did exactly for that organization. And we want you to do everything as soon as possible because even though nursing CAS is really simple, it takes a really long time to do everything. And in the image here, when you make a profile on nursing CAS, this is what your application will look like. So on the My Application tab, you put all your background and personal information. You put your grades, all your grades and all your classes under the academic history. So that also takes a long time. You also put your certificates or volunteer experience if you have any under the supporting information. And then in the Add Program tab next to My Application, that's where you will add all the schools that you'll be applying to for that semester. So Nursing CAS makes it easy for you to submit one application, the same application for multiple schools. And then if you add, for example, SFSU as one of the programs you want to apply to, under program materials on the bottom right, that's where that school will show up, and you would put the supplemental information that that school requires under there. So for example, SFSU, you would put your prereqs and their grades, you would give your T score, and then any supplemental information that they don't require but highly recommend, like if you have any military background, volunteer experience, and verification letters or recommendation letters, you would put that in the program materials section. So the most important thing about this is try to get everything as soon as possible. Again, it's really simple, the process of filling out the application, but it takes a really long time. And so you can start the application as soon as it opens and then save it and then go back to it as documents come.
Okay, so a lot of you guys are going to obviously have to take the ATITs test, and this is an entrance exam that's required for SF State's BSN program. You guys can take this pretty much anywhere, I think within the Bay Area. I know for me, I took mine at SJSU, but we do require, or SF State does require a score of 78 or higher, and you need to get that within 3 attempts. But from information that we've kind of gotten from current nursing students and people that we know, we would recommend a score of 85 or higher. We're not saying that if you get a score under 85, you won't get into the program, but a lot of the people who are in the nursing program did receive a score of 85 or higher on this entrance exam.
And then some of the tips that we've gathered from a lot of the nursing students would be to buy the ATIT Secrets book. I believe the people who made this book also makes the exam. So this does a really great job in breaking down all the concepts and all the sections. And then they also have like 4 exams in the back of the book. That's really helpful. It kind of mocks the exact real exam. So trying to do the test in the back is helpful as well. So we also recommend that you try to finish anatomy and physio prereqs beforehand because that's a lot of what the science portion tests you on. You don't have to have it done, but it's really helpful. We also suggest downloading a practice questions app. There's one at the bottom here that I personally use. It was really helpful because the questions were similarly structured as the TEAS exam. And then you can do like 10 questions a day up until your test. Another tip would be to join a Facebook TEAS group. And there's a really huge one on Facebook. They have a lot of supplemental information, free resources, free study guides that other students share with each other, as well as their stats and how it went for them. So You do get about, I think, 4 hours for the exam. You may or may not use the whole time, so doing practice questions will really help you in that sense. I know with COVID, we used to do the in-person exam to a facility, but I think with COVID, it's going to be online in your home, but it's just proctored. Some other tips would be to make a calendar of how you're going to study. Try to study a few hours a day, and then try to watch YouTube videos to refresh your mind of the concepts. I personally like to watch YouTube videos in 2 times speed. So yeah.
Okay, so I'm going to talk about the interview. It sounds scarier than it is, you know. I remember my interview, I was so nervous. I know it's hard, but I think that the best advice is just remind yourself. I think Lily mentioned this earlier and it was very useful, that they just want to see you as a real life human in front of them, and they want to see that, ask you why do you want to be a nurse, why do you want to attend nursing school, like what have you done, like who are you as a person. A lot of the questions that we can't tell you specifically because we were required to sign a non-disclosure thing before we went into our interview, but we can tell you on the general aspect that there will be a lot of character questions, very similar to if you were gonna go to a work interview. They will ask you a lot of situational interview questions, as well as relevant questions regarding the current situation of public health. And it is very important to, first of all, remember names, dress business casual and professionally. And again, when you go in there, when everybody, the interviewers introduce themselves, just remember what their names were, what in their positions, and know your school's mission statement very well. You know, that is their mission. That is the profile of student they are looking for. So make sure you learn the school's mission statement before you go in there. And also, you know, you're going to be a nurse, you're going to be a health professional. It is important to stay relevant on the current trending health problems that is happening in the world today, so that you can have stuff to draw from when you're answering your interview questions. And it just makes you look like, you know your stuff, and that you are ready, and that you're ready to be in the field. Practice mock interviews with your mentors, family, and friends, but remember, don't be scripted. Practice so that you have a natural flow of a way to answer questions, but just be prepared to answer any type of questions that someone may ask you when you walk in there. And you are for sure going to feel overqualified and over prepared after the interview, because the interview is going to go by like a blip, and you would just wait for the response afterwards, which feels way longer than it should. But the interview may seem intimidating, but just take it easy and make sure you practice good relaxation techniques. And like I say, just prepare yourself well and be yourself, and you should be fine. And this is some specific advice from SFSU nursing students that we were able to compile through our research. And you can take a look yourself. For example, this one here says, don't give up. Every step you take, not take it pertinent to your chance of entering the program. Plan out when you're going to take classes and volunteer / working, so then you know what to focus on in each semester. Be as well-rounded as possible. Highlight what makes you stand out. Use the pandemic as a lens of opportunity. Know that we are inside of a trauma and we'll get to the other side of it better and together. Do not be discouraged by the roadblocks. There will be roadblocks and more roadblocks to come. So just to reiterate, everybody's nursing journey is different. Everybody, we can tell you our experience that we have, but yours is going to be different. And that's what's so beautiful about nursing, is that everybody get there differently. Everybody have different character traits that make them a good nurse, and no nurse is the same as another nurse. So just hang in there and it will be okay.
Okay, so now we're going to open it up to our Q&A. Not sure if we have any questions that rolled in. I'm going to ask my fellow board members if we had any.
Sorry, Christina. So there was a question that was to me about, and I apologize if I start skipping, my internet connection is unstable apparently. With a Scribe, you don't need any certifications. It's a crash medical training course that the company will give you. And then on top of that, you have shadow shifts with the Scribe you're either replacing or one of their training scribes. And I think our company, we did 6 shifts, and within that time you would start by just watching and then slowly start taking over, so you are prepared to take over when it's your turn. A Scribe, basically you're doing all the documentation for the doctor, so they are required to write notes on their visit, and then they generally are supposed to sign them in order to get reimbursed. A lot of doctors don't have time or just forget to do it, so that's what the Scribe's job is. You basically have to have that note complete by the end of the visit, so that could be a 15-minute visit. So you get really good at listening and just like verbally typing it out. Some doctors also have you put in orders or diagnoses, so that also is how you get experience with what labs are available for certain things or what diagnoses are out there. They are medical diagnoses, which did trip me up when it came to nursing care plans because you can't use those. So that was an interesting transition, but it's still really nice to know. I also got really good at talking to doctors through it because that's who you're working with. So just adding that in since I realized I forgot.
And then I see we have a couple questions. I saw one is, when is a good time to volunteer? And I'm going to tell you what everyone's going to tell you. It's always a good time to volunteer. Now, tomorrow, during nursing school, yesterday. Always volunteer. It's super helpful, not only for nursing school, but volunteering is amazing. It makes you feel good, makes other people feel good. Volunteer immediately. I know some people who are volunteering during nursing school. If you're not in the accelerated program, you can volunteer during summers, volunteer whenever, honestly. It's always a good time. And especially during a pandemic, if you can say that you went out there, you looked for opportunities, you didn't just like give up your first time looking, you're going to look so much better on an application. They're really going to appreciate that you took the time to do something. I think it's going to mean even more than when we volunteered. It's going to mean so much more, because it's kind of scary to volunteer right now. Maybe it's a little, can be a little risky, even though, I mean, it's not risky. They have it set up so it's safe. But like, as long as you're showing that you're trying, I think they're really going to appreciate everything that you're doing.
I also wanted to add that it's never too late to volunteer. Say you're a third year college student and you have no experience, and you're thinking, oh, I'm not going to be as competitive as everyone else, but it's never too late. You can start now, and that would be fine. And you don't have to try to find, it's good to have health related, but personally, I did a playroom volunteer, played with little kids, and then I also helped serve dinner for families. So you can try to volunteer anywhere, whatever is available, as long as you have those hours, the 120 hours. It doesn't have to be specifically direct patient care, because that's really hard to get if you don't have a certificate in something.
Okay, I think we have a couple questions that were privately messaged as well. I have one person asking if volunteer hours that we did in high school before college also count or are taken into account. I think definitely they do count in a sense, and I think especially if it is healthcare related, it will be beneficial. But it's also probably more helpful to get more experience that's more current. So while you're in college, but I think it definitely does take into account when they are reviewing your application. Let's see. I have another question. Someone's asking if they currently work at a radiology facility as a receptionist who checks patients in and deals with charts and paperwork. Does this count as experience and volunteer? Would anyone like to answer?
I can take a stab at it. I don't know if my answer is correct.
Mhm.
It may count. Never hurts to list it. I think, and I was also originally looking at PA schools, so I focused more on patient contact hours, as that's what I count as volunteering, but I feel like that should count. So I mean, I'm sorry, that was a really unhelpful answer, but I would think it would count, but I think it's also a really good idea to try to get other experiences if you can as well, just to help broaden your horizons and broaden your volunteering base, and that will make you a better, like a more well-rounded candidate. But if you're specifically interested in mental health, search for other like volunteer opportunities related to that.
And then I'm seeing a couple questions regarding like CNA versus MA and like when should you be CNA and that kind of stuff. I think either route is amazing, or medical scribe. I saw that question. It definitely just depends on what you want. My mom is a nurse and she says the best, like Hanson said, the best nurses were CNAs first, because you really do get to learn how to deal with the grunt work of dealing with patients. And if you have a good CNA, you're gonna have a good day. Like if you can learn how to do that, it's amazing work to learn how to do. It's hard, but it's really good work to learn. But Marin, made a great point for being a scribe. There's so many options, so many ways to go about it. Nothing is good nor bad. So whatever your route is going to be is the way to do it. It just kind of depends on how you want and where you want to go about things. You can be a CNA in nursing school too. It's obviously hard with the hours we're working because we're very busy. But someone in my cohort just became a CNA because she was worried about clinical hours. So if you feel like you need to get more clinical hours, it's an amazing way to get clinical experience. So you very much can do it during nursing school. You just obviously won't be able to work that much. You could work I think 15 hours a week max probably, but getting just any experience like that is great. I'm seeing a question about babysitting. I don't know, that wouldn't probably be like patient care experience or anything like that, but it does help like if you like kids and maybe solidify more if you want to be a pediatric nurse versus something else. But yeah, I'm not sure if you could technically put that in like a application, but in your interview you can talk about anything. I was a restaurant server and in my interview they asked me when was something difficult you dealt with, and I said I talked about some difficult customer I had. Like you can pull from any experience you have. It doesn't have to be I was dealing with a dying patient. You don't have to like be this amazing person. Like you can have real life experiences, and as long as they know that you're a real person and know how to deal with real life issues, they're going to like you in the interview. So just, bring all of your experience to that interview. But yeah, that's definitely what I did. So any experience you can with anyone is helpful.
Okay, so we have about maybe 3 to 5 minutes left, and we're going to start wrapping things up. We apologize that we didn't get to everyone's questions, but we are keeping track of them. And if you guys do have any more questions for us, we are going to provide our email, which is right here. It's our breakthrough to nursing sfsu@yahoo.com. So yeah, if you guys have any questions, feel free to email us and we're going to try our best to get back to everyone. We also have a Facebook page for pre-nursing students. I think that would be very helpful for you guys. It's a good platform for everyone to communicate and ask questions to each other. You guys are all going through the same thing, so that will be very helpful for you. And we also would love to hear your feedback. We have a little survey. It's probably like 5 questions. It'll take like 2 minutes, honestly. And I think we're dropping that into the chat. So if you guys do have time, feel free to give us a little feedback about how we did and different ways we can probably improve for the next time. But we do want to say thank you. Thank you to our guest speakers who came to share their experience and help answer some questions, as well as the CHSS Resource Center for coordinating, collaborating with us. But yeah, thank you to everyone, and we really hope that you guys found this very beneficial and helpful.
I just want to say quickly that I'm seeing a lot of questions for our guest speakers. Please just forward that to our email, and I'm sure they will be happy to answer those questions for you. Okay. We just want to make sure everybody get their questions answered.
Awesome. So yeah, just fill out the forms. Amy's going to send out the stuff, the feedback form, and the what's the other one? Oh, the COVID volunteer one, because I think that will be really helpful for you guys too, to just look over and just click on those links and do that research. But definitely do your research yourself too. You're all smart, beautiful individuals, so you'll figure it out. But yeah, thank you guys so much, and we definitely hope you learned a lot today.
I just want to quickly say thank you to all of our panelists and for the Breakthrough to Nursing Committee for putting on this event. This was extremely helpful. I learned a lot from all of you as well, so I hope all of our students have also learned a lot. Thank you so much for collaborating with us. If you haven't already updated your name on your Zoom display, please make sure that it matches your SF state records, because this is how we will send out your the feedback survey, as well as the COVID information or any communication when it comes to pre-nursing. Please let us know if you have any questions. We'll type in our main email address if you have any questions for us at the SRC. If not, you have the Breakthrough to Nursing email address on the screen right now, and you can also ask them questions too. So thank you everyone for joining us today.